Safety First at the YMCA. Part 2, Bloodborne Pathogens. When working with children and anyone participating in sports and athletics, the chances are good that at some point we will witness an injury. Often with injuries comes blood. You have a right and a responsibility to know what to do to ensure the health and safety of the injured party, yourself, and anyone around you. To prepare you, should a blood incident occur, this module will provide important information about how to minimize exposure, defining precautions to protect yourself and those around you, and state our bloodborne pathogens plan so you know what to do. Let's start with a basic definition. Bloodborne pathogens are infectious microorganisms present in blood that can cause disease in humans. These pathogens include, but are not limited to, hepatitis B virus, hepatitis C virus, and HIV, the virus that causes AIDS. At the Y, you may be exposed to bloodborne pathogens in places like locker rooms, playgrounds, and anywhere a member or participant could become injured. Our first responders and housekeeping staff in particular have the greatest risk of exposure due to their job duties. All staff in the positions listed here, and many in childcare, are provided with more in-depth training on an annual basis to keep skills sharp and provide experience around dealing with exposure incidents. Staff in these positions are invited to obtain a hepatitis B vaccine at no cost to the employee and through our occupational health provider. If it hasn't happened already, your supervisor will give you the necessary paperwork to either begin the series or decline the vaccine. Many people have already received the vaccine through the normal vaccination schedule through your healthcare provider. You may want to check your immunization records to determine whether you are up to date. The best prevention of diseases is non-exposure and vaccines. Unfortunately, vaccines are not available for all diseases. When an exposure does occur, it can result in serious illness and death. It is important that you know the seriousness of these diseases and how to prevent exposure. The three main types of bloodborne pathogen diseases are Hep B, Hep C, and HIV. Hepatitis B is a disease that attacks the liver. Individuals can carry this disease for 30 years before they show any symptoms. This means that not only can you not tell an individual is carrying the disease, they might not even know it themselves. Fortunately, there is a vaccine available to protect you from hepatitis B. Hepatitis C also attacks the liver. It also causes other infections that vary in seriousness. Generally, individuals with Hep C have a short-term illness with flu-like symptoms within 6 months of contracting this disease, and then no symptoms at all. So people often confuse hepatitis C, at least initially, with the flu, and therefore do not realize they are carrying the disease. While for unknown reasons some recover without treatment, 75% will develop chronic, potentially serious liver problems. Unfortunately, no vaccine exists to protect us from hepatitis C. HIV also does not have a vaccine and there is no cure. Fortunately, there are treatments. This disease attacks the immune system and impacts our ability to fight infection. Like hepatitis C, the individual may initially show flu-like symptoms and then nothing for years, so they may not know they are carrying the disease. Because people carrying these diseases may not show any symptoms or even know they are carrying the viruses, the best way to prevent exposure is to treat all blood and bodily fluids as potentially infectious. We don't need to be afraid. By applying a healthy degree of suspicion and exercising some standard precautions, we can dramatically limit our risk. Using the proper personal protective equipment, following engineering controls, washing hands, and using hand sanitizers are very effective methods to prevent exposure. How do bloodborne pathogens spread? Bloodborne pathogens are transferred through exposure to blood or other bodily fluids. Any little cut or scrape, your eyes, your nose, or mouth, are portals for bloodborne pathogens to enter your body and cause infection. Covering these openings is your best defense. Latex gloves place a protective barrier between any cuts or openings in your own skin where infection can occur and the pathogen. Always wear gloves when administering first aid, cleaning, or any other time caution is necessary. Never administer first aid without first putting on your latex gloves. You can find gloves throughout the building and always in the first aid kit. If you're not sure, take a moment after this training to ask your supervisor where you can find latex gloves in your own work area. What if you don't have gloves available? Have the member or child control the bleeding if they are able. Call for help. Use a temporary barrier as a last resort. Whether or not the gloves are available, these additional precautions can further reduce your risk. Remember, any amount of fluid can expose you to a potentially deadly disease, so never take shortcuts when it comes to protecting yourself. Gloves are not our only line of defense. Engineering controls are another standard precaution to stop the spread of infectious diseases. Simply put, this means designing the work environment and the job itself to eliminate the hazards altogether or to reduce the exposure to hazards. In your work environment at the Y, you will find things like sharps containers, biohazard bags, hand washing stations, and work instructions which will eliminate or reduce your risks. All sharp objects, such as needles or bloody razors, should be placed in sharps containers. This prevents infection and accidental pokes or cuts. You can find these red boxes in the YMCA bathrooms or off-site in nurses' offices, for example. Red biohazard bags can be found in the first aid kits. You will use these to dispose of any materials that are contaminated with blood or bodily fluids that could be released during handling if compressed, or items that are caked with dried blood. It is perfectly acceptable to flush away a tissue used to wipe a small cut or bloody nose in the toilet. If a contaminated item cannot be flushed, use a biohazard bag. Latex gloves should be placed in the biohazard bag if contaminated. Special disposal bins are available in the housekeeping areas of our centers for biohazard bags and sharps containers. If you work in an off-site location, a school for example, follow disposal procedures of your location. If you do place anything in the regular trash that could have traces of blood, make sure to remove the trash, tie it tightly, and place it in the dumpster immediately. Work instructions and processes also prevent exposure to bloodborne pathogens. Whenever possible, have the injured person handle their own first aid and cleanup. Does a child have a bloody nose or scraped knee? Many children can clean the wound or hold the tissue themselves and flush away the tissue in the toilet. Never use your hands to pick up sharp objects like broken glass. Use a broom and dustpan. When throwing away sharp materials, use the sharps container or, in the event of broken glass, immediately take the garbage bag out to the dumpster. This way we don't risk anyone reaching into the trash can and getting cut. Speaking of which, never reach into a trash can with your hands. If you must retrieve something that was inadvertently thrown away, protect your skin from possible injury. If you are called to clean a contaminated surface, always use the proper disinfectant. And remember to wash your hands thoroughly and often. Always make sure to contact a designated first responder when bodily fluids are present. Don't clean up blood or other materials unless you have been properly trained to do so by the Y. If not a first responder yourself, you can help by keeping participants away and, if an emergency, following instructions from a first responder. Hand washing is our best defense against the spread of germs and disease, including cold and flu viruses, as well as hepatitis and other bloodborne diseases. The most effective hand washing method, according to the Center for Disease Control, is shown. Always wash your hands, and encourage participants to do the same, before handling any food or eating, whenever you have had contact with a bodily fluid, after blowing your nose, whenever you remove personal protective equipment such as gloves, after using the restroom, and after changing diapers. As you wash your hands, check them for any skin breaks. Report a potential exposure immediately. While soap and water are generally best, they may not always be available. You will notice hand sanitizer stations all over the Y. While it does not eliminate all types of germs, hand sanitizers with at least 60% alcohol do a good job at eliminating most. However, people often do not use enough sanitizer to properly eliminate germs. The technique they should use is apply enough hand sanitizer to completely cover both hands, usually about the size of a quarter. Thoroughly rub all surfaces of your hands and nails until your hands are dry. Do not dry with a towel. At your next opportunity, wash thoroughly with soap and water. In this section, we defined bloodborne pathogens and who may be at risk for exposure. We provided training and instructions for obtaining a hepatitis B vaccination if you work in a position that may put you at risk for exposure. We shared standard housekeeping procedures and disposal of waste, and communicated the standard precautions that you must follow at the Y to protect yourself. Just learning the facts about bloodborne pathogens isn't enough, though. You need to follow up. Do you know where to find latex gloves, biohazard bags, and sharps containers? If you're in an at-risk position, have you inquired about the hepatitis B vaccine if you haven't already been offered? Remember to contact your supervisor right away to answer any of these questions. Remember to follow the standard precautions and work instructions we've given you. Introduce yourself to the first responders at your work site so you know who to contact in an emergency. Congratulations! You've completed the second section of Safety First at the YMCA. Part 3, Incident Reporting, is the next step in your training.